Hey, it's Tim Reha here live at the Digital Health Summit, Consumer Electronics Show 2014. We're here with Neil Versel, talking about loudmouth patients making noise and making change, and you're moderating the panel today.
Right, so I was moderating the panel. I'm not the loudmouth patient, although I have been sort of a loudmouth advocate for when my dad was dying in a very poorly run hospital. In less than 48 hours, I stopped two adverse events just by being there. Had I not been there, who knows what would have happened, and unfortunately it happens all too much in American hospitals and clinics and doctors' offices and really any healthcare setting all over the country. So the panel was about, as the title states, loudmouth patients. We had a couple of loudmouth patients. They're Hugo Campos and Donna Cryer. Hugo has an implanted cardiac defibrillator, and he's been fighting with the device manufacturer Medtronic for several years to get the data that's coming out. It's a very high-tech device that actually produces data that he collects wirelessly with a box that he keeps by the side of his bed and uploads it to the manufacturer. He had to fight. He still doesn't have all the data himself, but he's at least gotten it so his doctor can get reports every so often. Yeah. And he's gone so far as to post his waveforms, his EKG waveforms on Twitter, and shared it on Facebook.
It's getting really loud.
So he's getting really loud with that. And one of the other panelists was Donna Cryer, who is a liver transplant patient, and she has had trouble making sure that she's getting all the right care, that all her doctors know all the information about her, and she said she's fired doctors for not wanting to have an empowered patient in front of them. And then our third panelist was Greg Matthews from WCG, who's more in the research realm, in the research and social media realm, and presented some findings, some preliminary findings of some research that he's done about the number of doctors that are active on social media. They tend to maybe not engage on social media with their own patients, but with just general patient populations. Maybe it's a little less formal that way, less chance of HIPAA violations as well. You're not don't have a personal relationship with that patient, but a lot of these are doctors who are willing to be engaged with patients who are engaged in their own care. And there was talk during the panel of maybe insurance companies or advocacy groups or associations specific to certain diseases come up with a list of doctors who are sort of e-patient friendly, you might want to say, some kind of seal of approval.
So should people be more vocal? What's your kind of gauge of the average patient? Are people vocal enough? What's going on there?
Okay. Well, I think the average patient still tends to trust healthcare professionals, not realizing that hospitals are really dangerous places. Misdiagnoses happen all the time in hospitals and doctors' offices, even though they may have been the victim of a medical error themselves, or if they haven't themselves, I'm sure just about everybody knows somebody or has somebody in their family, somebody that they're close to, who has been the victim of some kind of error, maybe being given the wrong medication or the wrong dosage, or had a misdiagnosis, or just was sent to the wrong specialist.
Yeah. So what are you trying to get out of CES this year? What's your involvement?
Okay. Well, my involvement, I'm a freelance journalist. I'm reporting on this conference for Moby Health News, and maybe dig up some other stories if I can. So, that's my primary objective of being here. I kind of take the whole CES show at face value, because I'm not one who needs to walk through all, 1 million square feet of show space or whatever it is. Maybe it's 2 million square feet. It's some ridiculous.
You need a motorcycle or a golf cart to get around this place.
I've always wanted to come to one of these big conventions. Usually it would be HIMSS, wearing rollerblades or something like that, but unfortunately the carpet gets in the way. So, nice. Yeah, but it's real hard to navigate. So I like the fact that the Digital Health Summit is contained to one meeting room, so we don't have a lot of walking to do, and go down to the exhibit hall. There are 300 exhibitors related to digital health and fitness this year, I understand, which the last time I was here 2 years ago, I don't know what the number was. It was less than 100, but I believe it was just 3 or 4 rows in the exhibit hall, which made it real easy to navigate. This year's a little more difficult, but it's like my job for my readers, and no matter what publication or platform, is to sort of sort through the hype and find out what's really going on, and not just what people want you to think, and understand try to figure out what is going to have a future and what product is probably going to fizzle. But more, I'm interested in concepts and trends than necessarily individual products.
Great. So how does people connect up with you and kind of find your different articles?
Okay. Well, Moby Health News is a good place to start. mobyhealthnews.com. You can always follow me on Twitter at @nversel, NVERSEL. You can also go to my blog at meaningfulhitnews.com. Just Google me. There are lots of ways to find me. I need to blog more often than I have been, but the blog is out there, and hopefully I'll also link to this video when it gets posted as well.
Perfect, Neil. Well, nice to meet you and get to catch up.
Thank you, Tim.